Okay, so chapter 13 is also pretty short. It's going to be about patient education and the dental radiographer. By the end of this chapter, you should be able to define the key terms associated with patient education, to summarize the importance of educating patients about dental images, list the three methods that can be used by the dental radiographer to educate patients about dental images, answer common patient questions about the need for dental images, x-ray exposure, the safety of dental x-rays, digital imaging, and other miscellaneous concerns. Okay, so why is this important then? Patient education is critical. Many patients do not understand the importance of dental images. Patients who are more educated about how comprehensive dental care is done are more likely to realize the benefits of dental images. And so it's important for the dental radiographer to explain why those dental images are important, how we use those dental images, and how those dental images benefit the patient, and how that benefit outweighs that risk. All right, and in that patient education, we need to help the patient understand. We're going to enhance that understanding of those dental images and enhance their understanding of X radiation and how we use it. It's going to decrease their fear of X-ray exposure. Some patients will show up to your office that honestly think that X radiation could cause cancer or could do these terrible things, and they don't realize that the amount that they're getting from a dental X-ray is actually much lower than what they may think. It's going to increase patient cooperation, so the patients who understand the importance of dental X-rays are going to be more likely to have X-rays done. And then once they understand why we're using those X-rays too, it's also going to make them more cooperative when it comes to accepting their treatment and the treatment plan that the dentist has prescribed for them. It's going to increase motivation for regular dental visits as well. Patients understand that not every single time they come into the office they have to get X-rays. It's all based on their individual needs. And so when a patient comes in thinking that they only come in once a year, or they only come in every couple of years, they think every time you go to the dentist you get X-rays, and that's not necessarily true. Comprehensive dental health education is one of the greatest services that we can provide for our patients. Giving them the education and giving them the understanding and the tools to make those decisions, that's one of the most important things we can give them. All right, and then these are the three different ways that we can educate our patients. We can do so either through an oral presentation, which is what happens most often. We can give them printed literature, which you can see copies of here. The ADA makes these, and you can purchase them and pass them out to patients who are maybe a little wary of having radiographs done. Or you can use a combination of both of these two, an oral presentation plus printed literature. It's also possibly a good idea to have maybe a video presentation that you play either in some type of waiting room, or you could play it in the room with you while you are taking the radiographs. That could help patients understand maybe part of why they're so important. Most patients will appreciate the dental radiographer just for taking the time to discuss dental images with them. I can't tell you how many times I've explained which X-rays I'm taking and what those X-rays are looking at with my patients, and it helps them to agree to the treatment. Patients are a lot more likely to trust you, and explaining it to your patients shows that you're confident in the need to take these X-rays as well. So patients may have a lot of questions when it comes to dental images. Usually it's not every single patient, every single time you take radiographs, but it is kind of random and off the wall. You'll be, in the middle of doing something and a patient will ask you a question that might throw you off. And so here are some of those frequently asked questions. This starts on page 125 in your book, and it might give you maybe some tools and some verbiage that you can use to answer those questions when they come up. So the questions they might ask are the necessity, the frequency questions, the questions about exposure, questions about safety, questions maybe about digital imaging, because that's what we use at Concord and that's what most offices are using, and then also miscellaneous questions as well. It's important to remember too that questions regarding the diagnosis of radiographs, as far as the individual patient's needs, those need to be answered by the dentist only, or through a conversation that you have with the dentist where you have the answer that the dentist is going to want you to be giving. You're not going to take that one from a book. That one needs to come from the dentist who is actually prescribing the radiographs for that patient. Okay, so some of the main questions that patients might ask you are about need and how much do they really need those dental x-ray images. And the first one is, are dental x-ray images really necessary? The answer for this one is yes. Most diseases and conditions such as tooth decay, gum disease, cysts, and tumors cannot be detected simply by looking into your mouth. Many diseases and conditions produce no signs or symptoms. Without radiographs, these conditions would go unnoticed. It's also important to note that we will be able to detect these diseases early in their stages, and we can hopefully prevent the further spread of any of these diseases that might cause pain or any kinds of further problems. And so the short answer is yes, dental x-ray images really are necessary. How often do I need dental x-ray images? This one is one of those questions that really is for the dentist to answer. The main answer that the book recommends giving is that the first step to limiting the amount of radiation is to receive proper prescribing or ordering of dental images. Decisions about the number, the type, the frequency of the dental x-ray images are determined by the dentist based on the individual's needs. How often should children have dental x-ray images is a very similar answer. It depends on the needs of the child, and each child needs to be treated as an individual, and those radiographs are prescribed by the dentist. Can I refuse x-ray images and be treated without them? The short answer is no. When you refuse treatment, when you refuse dental radiographs, you are shortening and limiting the ability of the dentist to give you the standard of care. And anytime a dentist is giving you treatment that is below the standard of care, it is considered negligent care. Even if you informed consent to that negligent care, at no point is any individual allowed to consent to being treated negligently. And so the short answer is no, you cannot refuse dental images and be treated without them. If you refuse dental treatment, you will have to be dismissed from having treatment. Instead of taking x-ray images, can you use the dental images from my previous dentist? Yes, you can. So if the previous images that were from another dentist are sent to your office and they are, one, taken within the right amount of time frame, so the frequency that the current dentist, your dentist actually recommends, and they're still current, then you do not need to retake them. And then also they need to be diagnostic. So maybe their office sent you a picture of radiographs and we're not able to actually diagnose anything from those pictures of the radiographs, well, then we would need to retake them. And it's important to discuss that with your patient, that even though they've had x-ray images sent over from their other office, if they are too old or if they are not diagnostic, then we will still need to retake them. And refusing to retake more x-rays is considered refusing treatment. And so you would have to not be seen. Okay, so the first question about exposure is, how do you limit my exposure to x-rays? I don't think I've ever had a patient so eloquently say, how do you limit my exposure to x-rays? But anyway, we limit the amount of radiation that we give our patients by a couple of different things. Number one is that we only recommend radiographs when they are needed and that the prescribing dentist recommends them in order to have. It's custom based on the individual. Not every single patient who comes into your office is going to get an FMX, right? We're going to limit the x-rays that we can as low as reasonably achievable with a LARA. And the next one is by using a lead-apron, like you can see here, and a thyroid collar to reduce the amount of radiation that the scatter radiation that the other areas of the body could receive. And then the other way is that we are using fast film, either f-speed film or we're using digital film in order to reduce the amount of radiation even necessary to capture the image. And then the last way is that we are using a film holder or a beam alignment device of some kind, which we talked about in chapter 6. And that is how we make sure we get a good diagnostic radiograph on the first time. Why do you use a lead apron? Well, we use a lead apron in order to protect and shield areas of the body that we would not want to have any type of scatter radiation sent to. So we use it to protect reproductive, blood forming, and thyroid tissues from scatter radiation. should I avoid dental x-ray exposure during pregnancy? So while the new American Dental Association recommendations, they got together with the Food and Drug Administration, and they found that with the use of a lead apron, there is actually almost zero radiation that actually is able to penetrate the lead apron and to travel toward the fetus. And so there is no longer a recommendation that says you cannot take radiographs during pregnancy. They are safe to take during pregnancy. However, most offices and Concord as well are basing our recommendations on tradition and the comfort of the dentist. And so some dentists, in order to make our patients feel more comfortable, we postpone x-ray procedures unless it is a critical or an emergency situation. And then, why do you leave the room when x-rays are used? So the answer, the book, it says it so well. I've actually never heard this answer this way before, so I'm just going to read it to you straight out of the book. Is when you are exposed to x-rays, you receive the diagnostic benefit of the dental images. I do not receive any benefit. An individual should only be exposed to X radiation when the benefit of disease detection outweighs the risk of exposure. Since I do not benefit from your x-ray exposure, I must use proper protection measures, and one of the most effective ways for me to do so is to maintain adequate distance and shielding, which is why I step out of the room. Isn't that great? Isn't that the best answer you've ever heard? I just love it. All right, and next is safety questions. So, are dental x-rays safe? The answer is no. It's unfortunate, but the answer is no. There are no safe dental radiographs because all radiographs all X radiation exposure does cause some type of biological harm. However, if your patient says, "Are these X-rays safe?" you're not going to be like, "Oh no, they're not safe." So what you would say is that while no X radiation is without any harm, that the benefit of detecting disease does outweigh the risk of the small amount of X radiation exposure that the patient would receive. And so you're definitely not just going to be like, oh, no. You're going to want to be a little bit more tactful with it than that. And then, will dental x rays cause cancer? And so the answer is while there is no definitive research that says it doesn't cause cancer, there is also absolutely not a single case study that has said that cancer was caused because of a direct reflection from dental radiographs. In fact, the estimated risk of exposure, you know how like when insurance agents they estimate your risk of having cancer based off of your dental x-rays is actually only 3 in 1 million, whereas a person developing cancer spontaneously is 3,300 in 1 million. And so when you compare the two, it's pretty clear that dental x-rays are not a significant source of radiation that would lead to cancer. In fact, I think that back when we were in that other chapter, it was like 500 something radiographs you would have to take in order to be able to even get a little bit of redness on your skin. And so the answer to do a dental x-rays cause cancer, the answer is no to that one. All right, and this is just a wonderful infographic that you can look at. There are many of these types of infographics that compare the amount of radiation that you would receive either through gamma radiation or solar radiation, and through cosmic and terrestrial radiation that you would receive in comparison to the medical radiation that is the dental radiographs fall into. And so you can see here that eating a banana, you get zero point 0.1, and that a single x-ray actually only causes 0.2. So I guess if you ate 2 bananas, it's like the same as eating or as getting a radiograph. And then getting a full mouth series is actually not on here. So dental panoramic radiograph is 10, and then everyday radiation is 10 as well. But having a full series is actually a little bit more than dental panoramic radiographs. And then a flight to LA, flight from LA to New York is 40. And so you can certainly see how patients get significantly more radiation through just everyday life than they do through their dental radiographs. And in all of these other, besides the benefit of being alive, or maybe going to New York, they aren't getting the same type of benefit of disease detection that they get through dental radiographs. All right. And so while I've never had a patient specifically say what are the advantages of digital imaging, I have on many occasions talked to my patients about how the digital imaging that we are using is safer than the traditional film, right? Because we know that the digital uses less radiation. And so when this gives you this question, it's actually just giving you some information as far as probably the other route around in that you said digital imaging is safer. So then the patient's like, well, how is it safer? That's probably more along the lines of what would happen than what are the advantages of digital imaging. Anyway, the advantages of digital imaging is that it requires less exposure to radiation, which benefits the patient. And so, what's also really nice about digital imaging is that they are able to manipulate the image a little bit more. So, if we didn't quite get the contrast and density correct, then we are able to manipulate the image. And I'll show you guys how to do that in the computer systems. And then we are able to store and send and enhance in a lot of different ways digital imaging over traditional film. And then what are the risks associated with digital imaging? And the risks are the same as the risks were for traditional film. There is a small amount of risk that is associated with having X radiation done in the dental office. However, radiation exposure is actually reduced by about anywhere between 50 to 90% through digital imaging over traditional film imaging. And what's also really nice is that through digital imaging, we are saving the planet from those processing chemicals as well. All right, and here are some miscellaneous questions, which I don't think I've ever really been asked, but I might as well. So, can a panoramic X-ray image be exposed instead of a complete series? And the answer here is no. That a panoramic image does not have the type of detail and the type of specific um, detail. It doesn't have enough detail, and so we have to take the intraoral radiographs in order to get that proper diagnostic radiograph. And then who owns my dental images? The dentist owns the dental images. Whoever owns that office at the time that the digital images were taken, that is the person who owns those dental images. And every office has to have a licensed dentist. So while some offices are owned by companies and some are owned by the dentist, either way, it's the dentist who works there that owns those radiographs. And what's nice is that patients can request a copy of their radiographs. They can have them sent either to the patient or they can have them sent to another office. However, the original radiograph belongs to the dentist. And then when you are going to do that type of thing where you're going to either send radiographs to someone else or if for instance your office used traditional film and you needed to make duplicates of the radiographs in order to send them to someone else, it would be reasonable to charge a fee for the patient to have those radiographs sent somewhere else, because not only does it cost the dentist money in order to make those radiographs, but it also costs them an overhead charge of paying the employee who has to then look up the radiographs and make that transaction of some kind. So either emailing them or duplicating those images and mailing them to the other dentist. And so it is reasonable to charge a fee for that kind of thing. So, like I said, this was a pretty short chapter. If you have questions, if you have really awesome stories about things you've heard of these types of questions, because I always love the questions that patients give me. I want to hear about them. So make sure you send me those my way. And then if you need to talk to me in lab, you can, and you can always send me an email as well. Thanks.